Sawadee Carp, hello and welcome to another Victor Black Masterclass video. In today's video, we are going to be talking about the drug Triptorelin and asking whether or not Triptorelin has a role to play, has a place in post-cycle therapy practice for individuals who use suppressive compounds like anabolic androgenic steroids and SARMs. Okay, so let's start the video with an understanding that Triptorelin is one of a number of analogs of gonadotropin releasing hormone. And gonadotropin releasing hormone, for those that don't know, is the hormone that is released by the hypothalamus and is responsible for the release of follicle stimulating hormone and luteinizing hormone from the pituitary gland. Now, as I said, there are a number of gonadotropin releasing hormone analogs on the market, and there are a number of potential clinical applications for this class of drug, and they include post-traumatic stress disorder, traumatic brain injury, recovery from traumatic brain injury, Alzheimer's, brain aging, nerve regrowth, muscle growth, even potentially there's a discussion around, is this a viable solution for testosterone replacement therapies? Okay. This particular video, we are going to be talking about just one slither of that discussion, which is specifically about GnRH as part of post-cycle therapy practice. And very specifically, we're going to be talking about the analog Triptorelin. Okay, so it surprises many people that are not familiar with Triptorelin to understand that Triptorelin has three principal clinical applications. One is in the chemical castration of men with advanced prostate cancer. Two is in the chemical castration of sexual offenders. And three is in the suppression of, let's just call it the onset of early puberty. And when you hear that list, you think, what the hell has this drug got to do with post-cycle therapy practices? Because that's exactly the opposite of what we're trying to do here, which is very obvious, right? But bear with me, you'll appreciate where this drug might fit into post-cycle therapy practices in the following slide, right? So it's enough to understand at a 101 level, a primer level, that Triptorelin is a very potent analog of GnRH. Okay, so when you give Triptorelin to someone, the consequence is that it is a super agonist. It produces a very potent outcome when compared to natural GnRH. You see here, this is a graphical representation from a study where they basically gave the same amount of Triptorelin in terms of dosage compared to natural GnRH to an individual, and the consequence was that approximately 10 times more luteinizing hormone was produced. So it is what we would call a super agonist. It produces a very potent outcome. And you can appreciate that if you overstimulate the endocrine system, you have the potential to basically ultimately result in shutting it down. Okay, now the reason that Triptorelin is used for chemical castration is exactly that. If you administer Triptorelin in a chronic manner, in a sustained manner, in other words, if you expose an individual to enough of this drug, you not only stimulate the endocrine system to produce luteinizing hormone, you overstimulate it, for want of a better word, and ultimately end up shutting it down, and that's how it works as a castration tool. But if you are very careful and use a very small amount of this drug, you have the potential to basically just see this initial spike that we see. So we see a very high release of luteinizing hormone in very short order, and that can be enough in this capacity to refire or restart the endocrine system under certain conditions, under certain circumstances. And I'll explain what those are in a moment, because this is not a fix-all for everyone, and it is also not in my opinion, a solution that you should use every time you undertake post-cycle therapy practice. So, is there any evidence specific to our tribe that relates to the use of Triptorelin and post-cycle therapy practice and the abuse of anabolic steroids? Yes, there is a case study which is quite famous in this domain, done a few years ago, on an individual who had exposed himself basically continuously to steroids for multiple years, and they basically had trouble restarting his natural production. He was administered a single dose of triptorelin, which resulted in a very elevated spike of luteinizing hormone, and that successfully restarted his natural testosterone production. So there is supporting evidence. This is not complete bro science. There is, as I said, a very interesting case study to be read on this subject. Let's talk about the challenge, though, of using this drug in that capacity, and that is the challenge is getting the protocol and getting the dosage and getting the quality of the product right. Because if you mess it up, you have the potential to make everything worse, potentially. This is a graphical representation of patients receiving triptorelin for the purposes of chemical castration. And you'll note in this particular product, this version of triptorelin they're using, that these are the points of administration where these gray arrows are, rather. So in other words, a single subcutaneous administration of this drug produced chemical castration. It's not like you use it every day and eventually you find this thing. One shot. What varies is how much did they administer. Was it a micro dose or was it a larger dose? And in this graphic you can see a larger dose. So this was 11.25 milligrams of a triptorelin pomoate administered at week 1, or day 1 I should say, and at week 13 to produce basically chemical castration over a period of 26 weeks. Now, that is a reversible process, okay? Ultimately and eventually, the consequence of this administration will, for want of a better word, wear off. All right, it's not permanent shutdown, but it is long-term suppression due to the overstimulation of the endocrine system, due to the potency and the long half-life of triptorelin by comparison to gonadotropin-releasing hormone. Okay, so hopefully you can understand that then. What that means is that, yes, this is an interesting class of drug, and yes, it has a role to play, and I'll explain where I think that role is, but you need to be careful that you don't make everything worse with this drug. You've got to get it right, otherwise you will find yourself, worse off than you were before. So, where would someone potentially use this drug? What I would suggest is that this is not a drug that you use when you're cycling on and off of anabolic steroids, right? We have other drugs that do just a fabulous job at helping us in that regard. And the reality is that there's always going to be an individual who has decided that, and he's walking away from the world of anabolic and androgenic steroids. He's been through the right way, quote unquote, right way to do post-cycle therapy. And there is absolutely a right way to do it, and almost nobody does it. And if you're looking for more information on the right way to do post-cycle therapy, you can get that from muscleandiron.com. And basically, for that guy, right, who's walking away, and if he's tried everything to do it the right way and he's still unsuccessful, would I put this protocol on the table? Absolutely. I don't have a problem in the world with doing that. But one of the reasons behind that is he really doesn't have anything to lose, right? The risk of this protocol is that you shut yourself down worse. He's already shut down. You've tried everything you can, and he hasn't responded to that. What's the worst thing that can happen in this scenario? This is a approved for human use drug, and we know the consequences of it. It's pretty hard to imagine that you're going to do anything worse, right, if he's already completely shut down, right? This is a valid and viable, what I would call last chance to restart natural production. Hopefully that makes sense in that context, okay? But I would caution you in this regard. Before guys get their hopes up about the capacity for this drug to restore natural function, we have good evidence today that basically helps us to understand what happens when you expose yourself to years of anabolic and androgenic steroid use, and why you ultimately end up suffering permanent natural production shutdown. And that is actually nothing to do with the pituitary gland or the hypothalamus. All right, it's actually to do with damage to the ultrastructure of the testes. So you can see here in this study, there's a control group and both current AAS abusers and former users that have basically, been using this drug for years. And when they go off of these drugs, in relatively short order, their follicle-stimulating hormone and luteinizing hormone values return to normal, effectively to the same levels that they did before they ever exposed themselves to these compounds. The problem that's causing the shutdown is not the production of luteinizing hormone. It's the damage, as I say, to the testes. Okay, so the testicles don't work correctly anymore, and the Leydig cells in the testes are incapable of producing testosterone at previous levels. And so, as a consequence of that, using a drug whose function, whose role is to elevate luteinizing hormone, isn't going to do anything. Okay, it's using a drug with no hope of an outcome there. Okay, so this is what I would suggest. If you're an individual walking away from this world and you've gone and got your blood work done and you've done everything the right way in terms of post-cycle therapy and you have been unsuccessful in elevating your luteinizing hormone and your follicle-stimulating hormone levels, then this class of drug is something that you might put on the table for discussion and consideration. Sure, right? But if you go and get your blood work done and you're like these individuals, you have normal high follicle stimulating and luteinizing hormone values, then triptorelin isn't going to do anything for you. Okay. So that's it for today's video. As always, I hope you enjoyed that, and I am happy to answer any questions you have on this video. If you're looking for more information about triptorelin, about potential protocols and dosages, and even sources, and all manner of discussions around performance enhancing, go to muscleandiron.com. I look forward to seeing you at the next Victor Black Masterclass video. Sawadee Cup.